Can you hear me, everybody? Sorry. Can you hear me?
We can.
Awesome. All right. We are, I always joke, I'm the only person in Silicon Valley that doesn't have a good Wi-Fi connection. So I apologize for the signal issues. But as Khalil just described, Khalil and I work together really side by side on implementations on a solution that's very focused on digital contact tracing. I focus on the United States. We overlap in the Caribbean because it's a place where Khalil is from and I love. And then Khalil is very focused on the global side. And so we're excited today. This is the last of a 3-part series that we have been doing over the past month and a half on the Caribbean, linking together policy with economic development, with tourism, with COVID, with all these issues that are facing countries in our region, and how can we best solve for them. And so, yeah, we're so excited to have you here today. Thank you.
Dr. Landis, how about you start by introducing yourself?
Okay, so I'm Clive Landis. I am the chair of the University of the West Indies COVID-19 Task Force. And I probably should say something about myself. I married a St. Lucian, your countryman. And so we live here in Barbados in the Caribbean and have done so for the last 18 years. So I'll give the perspective for the region, and I can speak to Barbados and the region that the university serves.
Yeah, thank you so much for joining us. And so we've actively been engaged with a number of countries throughout the Caribbean on COVID-19 containment efforts and the use of technology there. What we've seen very interestingly, and it is sort of this lack of tech infrastructure in the region that allows for the adoption of solutions like, the digital contact tracing tools that are being deployed around the world. And it's not so much only contained or it's not only within the region or smaller developing islands who have issues with this adoption of solutions, but also developing countries. At UWI, what has been your experience with digital contact tracing tools? Is this something that you guys are exploring over there? Is it not? And how are you thinking about containment efforts for COVID?
I think I should say for contact tracing, it's obviously vital for the containment of the epidemic. So we should probably start where we're at in the Caribbean. So the University of the West Indies, we serve the English-speaking Caribbean. So that would include English-speaking countries in Central America like Belize. It would include English-speaking countries on the South American mainland, so Guyana. And it would serve all of the CARICOM countries, the small island states that you'd be familiar with, Barbados, Jamaica, St. Kitts, St. Lucia, etc., and all the way up to some of the UK overseas territories who are associate members of CARICOM, so including Bermuda, for example, Anguilla, places like that. So the University of the West Indies serves 17 member countries. If we look at the countries that the university serves, you have a minuscule number of cases and deaths. So the Caribbean has done a remarkably good job in containing the epidemic, especially when you consider what's happening to the north and to the south. So to give you some statistics, if we include the largest designation of CARICOM, which would be the small island states, but also including Haiti, which of course is the only low-income country in our region, and it would also be the largest. So that would have a population of around 10 million. So the 20 CARICOM states, including Haiti, would have a population of 16 million. Now, out of those 16 million, since the beginning of the epidemic, we're now on our 99th day since the first imported case in Jamaica. We've had 152 deaths, that's it. So incredibly low numbers of cases. The cases are just over 6,000. 5,000 of those would be in Haiti, but really very few deaths. So where contact tracing is obviously critical is in containing the epidemic, testing persons and tracing them. Now, we've taken a largely manual approach, but of course that works when you have small islands. You know, no one can get away from you on an island the size of St. Lucia or Barbados. You know, Barbados is sort of 18 miles this way and 14 miles that way. You know, no one's going to escape us. And so even quite big outbreaks, for example, the call center outbreak in Jamaica, which was 200 persons in one cluster, and it extended to 600 persons eventually being found positive. That was contact traced manually, and persons were isolated. We have great isolation facilities in the Caribbean because we have all these hotels which are empty. And so the Caribbean has really done a very good job. And it's based on the foundations, the pillar of testing. The testing has been excellent from the word go, and contact tracing, and we are doing it manually. So you can propel us towards the digital solution.
Very, very happy to do so. In fact, we have some very initial engagements going on in Barbados. And in Haiti, we're working very closely with the government there, with their population, to get those digital solutions adopted. I wanted to ask about, you know, the next steps for the Caribbean, right? You're doing manual contact tracing, but the islands are largely dependent on tourism, this flow of traffic across international borders. We know that the caseload in the US, in Europe, is, you know, quite significant, but we're dependent on those people to travel to the region. How is UWI, or the task force within UWI, working with all of these countries, thinking about getting people back into or coming into those islands?
Yeah, well, you know, this is going to be the real issue. So it's all very well having containment, or even what some countries call elimination. You know, New Zealand had eliminated the disease, but as soon as they opened up the border, they had cases. So this is going to happen. I often say to stakeholders, you know, there are two absolute knowns. The first known is that we must reopen our economies because the Caribbean is just being killed economically. So we've had almost no impact from the virus itself, but the economies are going to contract anywhere from, you know, typically around 20, 25, possibly even more percentage points because of how reliant we are on tourism. So we must reopen. But when we reopen, we will import cases. And so the contact tracing and the isolation of those, the identification and isolation of those cases is going to be critical. So I think we've set up some good structures, but an automated contact tracing solution that some of our visitors could participate in, I think would be very useful.
Yeah, and I think
that can you speak, Khalil? Like, can I jump in? Yeah. We're really like where we want to work with you, Clive. I think is this opportunity of like there's two populations that we're working for, right? Is we're working for a local population, which is let's protect the populations of a Barbados or a Bahamas or a Haiti, but then we're also trying to create a safe destination for people that want to travel when borders open, which they're opening right now and in July. And so what is our, like, what do you feel like ethically is our responsibility as it relates to that? And like, what can we be doing better as a contact tracing team? But we're I think Khalil and I would both say we're like much more than that. We're really trying to be and wanting to be a resource for countries to enter into the space in a safe way.
Well,
Khalil, I don't know.
So you know, we don't make any distinction between the inherent value of an indigenous person or a visitor. We must keep visitors and the home population safe, and solutions which will help to do that are incredibly welcome. I see that there will be two shifts that we will need to make when we reopen. So only a few countries have reopened up to now. Most of them are saying they want to start in July. And the two shifts are these. We have to go into a heightened surveillance mode in the community. And so you might imagine that there would be, particularly in large hotels, there would be permanently stationed, trained community health nurses who would meet people at the check-in. They would establish a liaison, a bond with them, explain, the situation, what to do in the event of, and they would be trained in monitoring for acute respiratory infections. And so you would have a sort of a heightened surveillance network in places of traffic like supermarkets, shopping centers, transport hubs, and especially hotels and guest houses. And then the second is the automated solution, which I think you're proposing, so that we can retrospectively, if a tourist has been shown to be positive, then we can see where that tourist has been, what other persons he might have been in contact with for a significant length of time, whether they're in the hotel or outside of the hotel, and then we can put into place the isolation and quarantining facilities, which we have. They're working very well. So all the components are there, but I think we will need to move that to that heightened phase of surveillance, using both ARI nurses who are trained in detecting acute respiratory illnesses and in the community, and also the automated solution so that we can identify persons who might have come into contact with confirmed cases.
Yeah, you used the word surveillance, which can be loaded, right, depending on who the audience is. And so I think it's always, yeah, exactly. I think it's always.
I'm not doing any sort of Big Brother surveillance.
Yeah. And so in a lot of our conversations, and we have been actively engaged with so many countries around the world, this is the first thing that they're asking, right? What about the privacy of our citizens? What about the users and how we're protecting them? And we tend to avoid the use of the term surveillance because it usually is associated with surveillance states and how governments with maybe nefarious intentions can use people's data and continuously observe them, which is a totally different meaning from your instance, which is public health.
Medical surveillance is a very benign term. So it is the correct term to use, and so I do apologize if people might be doing Big Brother. But when you speak about these solutions, which have to do with automated contact tracing, the issue of data privacy does, of course, arise. And certainly our university has adopted a GDPR, which is quite a tough standard from Europe. And so using those standards, as long as persons know what they're signing up to, as long as what the data is used for is explained, and you don't sort of sell it on to advertisers so that you get ads from the local shopping mall or something, that's fine. I don't see an issue with that as long as people know what they're signing up to. So we do use those international standards here.
Yeah. Oh, that's good to know. I wasn't familiar with GDPR also applying to the Caribbean region. I know it is a very tough standard everywhere in Europe.
It applies to you too?
To me as well, yes.
But I mean, it's obviously caused controversy because, on sort of 1st of April 2018 or something, when it came into effect, the European Union fired off all these letters to sort of Apple and Twitter and Facebook and everything, saying you're not complying with our standard. And they're like, hey, we're an American company, but because they're global, the argument was that there should be something uniform. So what happens is that when sometimes you don't have your own standard, a lot of our countries are quite small and we wouldn't be able to develop our own standard. We just go to a standard that is already a best practice or a good standard, and then we use it.
Do you think that standard, the GDPR standard, is something that is localized to the Caribbean? It applies to the Caribbean context. Should we adopt the same standards, or should we have our own?
Well, I think we need to have standards, and if we don't have any local ones, I mean, sometimes you will find, for example, in my discipline, which is laboratory research, you would find that there is no local laboratory standard. And so all I would do is I would take an existing standard, whether it's from the US or from the UK or Europe, a good one, and use it. And I think there's nothing wrong with that, providing that you use it in the right ways, explain to the persons who are using it why you're doing so, if eventually we all move onto one single global standard, that would be even better. But for now, I guess the GDPR was the first one through the block, the first really serious standard that made ambitions to be fairly international, and so we have adopted it.
Yeah, I wanted to ask another question about technology in healthcare, right? So we're familiar with, advancements in technology in patient care and primary care, but not so much in population health, right? And so we're seeing this new sort of market being developed for tech solutions, for digital tools in public health. And in our engagements throughout the Caribbean, we're seeing that a lot of the health departments aren't set up to accommodate them. What are some of the challenges that you see being faced by some of those entities, those government entities, the Ministry of Health, in adopting these solutions? And how are you thinking about, bringing on these solutions?
Well, the University of the West Indies, we have an advisory role in the COVID-19 response. It's really not for us to say what sovereign countries should adopt or shouldn't adopt. But we certainly advise as a best practice, particularly based on Asian countries, which have used smartphone contact tracing very effectively, like South Korea, like Vietnam, China as well. I have a particular penchant for Vietnam because my brother, he went the other direction and he married a Vietnamese lady. So, they have extremely effective contact tracing, which is in several shells. Whether you've been in contact with a person who was later shown to be a confirmed case, or even a second shell where you were in contact with a person who was in contact with a case. And so they have used that very effectively it's a huge country of 90 million people bordering China, and they've had 0 deaths. And they've only had something like 250 cases, but their quarantining and isolation measures have been magnificent.
Yeah, Vietnam is also one of those countries that we worked with very closely early in the pandemic. And you're right, they did employ some very strict measures, put some very strict protocols in place to contain, and we're seeing that it is working, right? Before I go on to my next question, which was going to talk about, all of these crises coming together in the Caribbean with the pandemic, and then, we're now entering the hurricane season, which is projected to be active. And then I think add to that, the really tough economic environment that we're in and the decisions that need to be made. I wanted to bring Sienna in if she had any thoughts on this, the convergence of crises in the Caribbean, and how UWI is thinking about this in particular.
Yeah, I'm very obsessed with this, as you know. And so, Clive, for us, we're thinking about what does it mean to have a crisis with COVID and to have a protection, because the Caribbean has done an exceptional job of protecting its citizens. What does it look like to open up to the United States, which is going through hotspots and peaks of the virus right now? And how do we address the need for economic development and tourism while also protecting local people? And what is that balance? That's where we're very focused. I plan to come down in July and I'll be in the Caribbean, but that's a problem that I honestly go to sleep thinking about every night. How do we do this best?
No, yeah, it is the toughest of issues because as a region, the Caribbean is more dependent on tourism than any other region in the world. And, the economic devastation is just, it's off the scale. And it's going to probably take decades to overcome. So this is exercising us tremendously at the moment.
Absolutely.
And we're trying to we're trying to understand, what is the best protocol. And so at the moment, we don't have a standard across the Caribbean. But to give an example, St. Lucia is requiring persons to do a test in their home country within 48 hours before traveling. If there was a reliable self-test, an antigen test, which one could do quickly, then potentially we could install that in our own airports. But currently, there really isn't anything suitable. And it's just this conundrum of how do you open your borders, but do so in a way which is safe to both the local population and to the travelers. It's at the moment, we don't have all the answers because we just don't have the necessary tests which are quick enough to do on the spot. They just don't exist at the moment, or not reliable tests.
Oh, I think we might have lost Sienna, but that is a very interesting thing. The dependence on tourism in the Caribbean and some of the other countries as well. We are engaged in with some governments in the Mediterranean and then throughout Africa who are also dependent on tourism, and they're all taking very different approaches, right? Is there a need for all of these countries to come together and adopt a single set of protocols for reopening societies?
Well, you mentioned, other island states. You also mentioned Africa. So ACP is a designation, Africa, Caribbean, Pacific. And for various health domains through the WHO, the ACP is used. And so it's used for environmental factors. It's used for various health programs. So the ACP is a recognized region, and we have a lot of kinship with the Pacific Islanders. And I noticed that Vincent Munoz is from Guam, I think.
Yes.
So the Caribbean, certainly does have kinship with other island states, whether it's Greece or whether it's Indonesia or Pacific Islands. And some of the solutions be very similar.
Yeah, and so we always think about healthcare, a person's health status as part of, a broader, more extended productivity function, right? That is, if you're going to be productive, you need sound health, right? And then for productivity to take place, we need the economy back up and running and people going to work. Are you actually engaged on advising some of the governments on how to reopen the society?
Yes, absolutely. So we have a role, and it's mostly on information and research. So it's a shame that Elizabeth Riley was not able to join us. She's the acting head of the Caribbean Disaster and Emergency Management Agency. I work very closely with Elizabeth, and the Disaster Management Agency is actually coordinating a lot of the response, which has been so successful here. And so the Disaster Management Agency already has, a lot of structures to do, for example, with, ports and airport security. Just think about how we would get samples and protective gear from one country to another. So not all of our islands have their own ability to test samples. So they have to be brought to another island to be tested. And with all of the commercial airlines being shut down, it actually ended up being the regional security service that's done a fantastic job. And so this military plane is just going from island to island to island, picking up samples, dropping them off. And we're turning things around usually within a day. We get the test results back. So the Disaster and Emergency Management Agency, which deals with weather-related disasters, in particular hurricanes, they've basically just added a health bubble onto all of those other structures that they have. And when we looked at it, it actually resembles what's known as the WHO's Health Systems Framework, which has these 6 domains. And in this pandemic response, all the 6 domains, which starts with political leadership and the health workforce and protective equipment and financing, health financing, information and research. And it has all of these pillars are all there. And it's all coordinated by our disaster management agency, which is, I think, very impressive.
Yeah, but there is, so I'm going to ask this question because I know that in the Caribbean, a lot of the testing takes place in Trinidad, right? So each island doesn't have their own testing facility or, the ability to process those tests themselves, those testing kits. Mm-hmm. Is that a problem? I mean, sure, we've certainly been, successful in containing, but, in the event of, say, a bigger outbreak where you need those immediate testing results, right? How are you working around this? How are you working within this framework?
Very relevant question. And, if this had been 4 years ago during the Zika outbreak, we would not be able to contain the disease. So we've had 4 viral outbreaks in the last 10 years. We had the swine flu in 2009-2010. We had chikungunya in 2013, Zika in 2016, and now COVID in 2019. Way back in 2010, we almost had no viral detecting capacity at all. There would have been 1 lab in the Caribbean that could do it. And then by chikungunya, it was like 2 or 3 labs, and then 4 or 5 by Zika. Now we've got 10 labs in the Caribbean that can do it. And then there's the regional hub laboratory in Trinidad, which, as I mentioned, the military flights just bring the samples daily. And the turnaround time for the most complicated one, which is from a small island to Trinidad, the turnaround time for the result is, the average is 33 hours. It's fantastic. I mean, most labs in Europe or the US wouldn't be turning around results so quickly. So the testing, which absolutely you're right to say, it looks like it should be a weak point. For the first time, I guess based on the fact that we've had so many outbreaks, one after the other, it's actually really strong. And it's actually a pillar upon which the whole containment effort has been based. So it's working well. And it certainly would be enhanced if there were reliable rapid tests, which could be on the spot and in smaller countries.
Yeah. So given that, all of the islands are sort of dependent on each other to provide this testing capability or increasing capacity to do this testing, is there a need for a central database of patient data in the Caribbean?
Yeah. So,
and if there is, who gets to manage and regulate this?
Yeah, we don't have a health information management system, which I think what you're talking about, and actually deeply penetrating database, which would, have persons' personal medical information on. And we don't have that level of integration of health systems in the Caribbean. Probably the closest you would get would be in the OECS, which is the Organization of Eastern Caribbean States, which of course St. Lucia is part of. And so they do have some common health systems which they operate. But I think it would be quite a big ask to have one single system for what is basically a geopolitical alliance, CARICOM. It's not a federation, in any real sense. It's not like a federal system of states, where you all have one set of rules and governance like you have in the US or something. So, these countries are very, very different. I think it would be maybe a very long time before we got that level of integration. But what we do have is we have, on a more population level, we do have common databases. So, for example, for COVID-19, we have all the regional information, which is put together by UE. We publish it daily, and has really nice analyses about where the regional hotspots are, how the growth curves are doing for every single country and the region, what the deaths are, again, if there are any hotspots. So at a population level, at a larger level, we do have that level of integration, but not down to the individual patient.
Yeah, that's very interesting. And I wanted to touch a little bit on that. You talked about research earlier, and it certainly sounds like the decisions that you make are data-driven, right? You're using insights from the data that you collect, the hotspots, to make decisions. We don't see a lot of that in decisions around economic development in the Caribbean. it largely the process used isn't driven by data, it isn't informed by data. Do you see yourself as playing a role in sort of working with governments to get them to adopt this?
So our task force, so we've organized ourselves in a task force so that this body, this task force, can interact with the other organs of the Caribbean states, either at a national level or international, meaning a regional level. And so we have on our task force, it's not just virologists and veterinary virologists and critical care physicians and pulmonologists and that medical epidemiologists, that medical side, but we also have tourism specialists, we have social scientists, we have gender experts, we have an ethicist, we have economists. So we do have those people in our task force. And you know, each of them is interacting with their own stakeholders. So we have a very active tourism specialist who's engaged with the Caribbean Tourism Organization, the Caribbean Hotel and Tourism Association, and does lots of the brainstorming and thinking together with them. So we are very much thinking of how to help the Caribbean to reopen and to re-engage economically. That's very much part of our remit.
Yeah, and are there pockets of populations or communities within populations in the Caribbean that you see have been affected more so than others?
Sorry, say that again, please.
Are there pockets or communities within the populations in the Caribbean that you see being affected more so than others?
Oh, absolutely. Women, you know, that gender divide, that's global. So, you know, women are disproportionately affected because not only are they more likely to lose their job because they have these home care duties, but they're also less likely to rejoin the workforce because, again, schools are closed, they have duties at home, and, you know, they're juggling sometimes, you know, if they still have a job, working from home while having all of their care duties and so they're definitely disproportionately affected. So we've made sure that we have one of the heads of our Gender and Development Institute taking part in the groups which are discussing the reopening, because we want to avoid what the UK did. I don't know if you heard about the committee that decided on which activities would be first permitted in the UK, and they came up with golfing, angling, and shooting. You can guess what the gender composition of that, you know, and so, you know, we are very much involved in all of those discussions about how to reopen the economies.
Yeah, but you know, there could be long-term health repercussions for, you know, if women are at home, they're not working, then they're unable to feed their families, themselves, and then obviously there are health implications, right? So are you and your team thinking of long-term strategies?
Absolutely, yes. So we have a psychosocial unit within our task force. They've been very active. So we first of all assess the psychological status of our students and our staff. And really, I've rarely come across a survey that was so startling. So 2/3 of between 60 and 67% of students and staff had either moderate or severe anxiety or symptoms of depression. And, you know, that quadrant normally has 3 sections, and the most minimal section just wasn't there. Everybody in the survey of whatever it was, 5,000 odd students, had some form of anxiety or depressive symptoms. And we've now taken that survey because, you know, we've had it properly approved with all the medical ethics committees. And we're now applying it to populations in general. So we started with Trinidad, and so in the community, but we've also applied it to frontline workers in a number of countries. So we have a multi-country study with the US, the UK, South Africa, and some Caribbean countries where we're looking, using the survey to look at how it's impacted psychologically frontline service providers.
Yeah, that is, mental health issues is something that is so heavily stigmatized in the Caribbean. So it's good to know that there are efforts being done to address it. I want to, in the interest of time, I know we're running short on time here. I wanted to talk about, the theme of this webinar, which is the next 6 months. What are some of the challenges that you're expecting to come up against?
Well, I think it's going to be, more of the same in terms of the disease. The disease doesn't seem to be going anywhere. There's going to be no major breakthroughs in terms of vaccines. And even if there was, let's say, within 6 months of vaccine, we wouldn't get it in the Caribbean. We would have to wait until some of the countries that have first dibs at that before we would get it. So we're not expecting, some kind of a game changer like a vaccine for at least a year. And we're certainly not expecting this disease to go away. It seems to be spiking at the moment in South America, even in North America, with the exception of New York, where it's coming down. It's actually on the increase in a number of US states. So we're not expecting this to change. The big change is going to be the reopening of our borders and what that will bring. And I'm confident that we have the tools in place to contain whatever might come, because there will be imported cases. So, we have the testing, which is the absolute bedrock. We have the quarantining and the isolation procedures. Our contact tracing at the moment is mostly manual. It could certainly do with a automated tool. But my own personal belief is that the most important thing is to have heightened what's called ARI surveillance. Sorry about the surveillance, but that's medical. Acute respiratory illness surveillance in communities, across the islands. And so we should be able to pick up wherever we might have a little cluster.
Yeah, I will be getting in touch with you shortly after the call to talk about digital tools that you can use in UWI and throughout the Caribbean. But I wanted to get back on the topic of vaccines. Do you expect to be challenged, to come up against a challenge of how people perceive the vaccine, whether it is something that is useful, or should they take it? Do they trust it?
We don't really have much resistance or sort of anti-vax movement in the Caribbean. Yes, you might have a few persons who are skeptical about vaccines, but the vaccine programs have been one of the big, if you widen the lens to the last 50 years, the vaccine coverage, smallpox, cholera, MMR, etc., the vaccine coverage and the increase in length of life that led to in the Caribbean over the last 50 years has been dramatic. So people are well aware of the health benefits of vaccines. So we're not really scarred in the same way with all this misinformation that some countries who I guess have taken vaccines for granted are experiencing.
Yeah. And so once the borders reopen, what happens if there's a second wave? What happens if people come in and start?
We haven't had a first wave yet. So, we want to maintain this, which is essentially a paradigm of containment. And I think we can do so, where we're expecting to have imported cases, we're expecting to have little clusters, but we're ready. We're really ready. And so we would hope that we would be able to have containment, let's say in the same way as Singapore had. It's not as if it's been without blemish for Singapore. They've had a couple of, pretty significant outbreaks, to do with their migrant working communities. Also, South Korea had some outbreaks related to churches. We are expecting outbreaks, but those countries have still contained the disease, and we believe we can do so as well.
Yeah. And what about cost to health service in the Caribbean? How is that impacting how people react to the stresses of COVID-19?
So I think persons are becoming much more aware of who is an essential worker and who isn't. I have a feeling that if I was to, just disappear, no one would miss me. But frontline workers, I think people know who is an essential worker and who isn't. So I think there has been a real appreciation for the work done by frontline workers, not just healthcare workers. And in terms of the impact on our healthcare system, I would say at the moment it's strengthened it because we haven't really had any devastating impacts. When you're speaking of 152 deaths, in 16 million people over 3 months, it's minimal. The impact has really, I think, been more psychological, and it's also unintended healthcare consequences. So people who have quite serious diseases needing treatment like hypertension, diabetes, cancer care, they're either unwilling or unable to access the healthcare services because they're worried.
Yeah.
Probably worse.
So we have two questions here that I want to get to. One is, how is COVID-19 different to Zika, chikungunya, Ebola, and the other previous outbreaks which required no mandatory vaccine?
Right. Well, I would say that we never had Ebola here, but if anything, it's more similar to Ebola because of the fact that it's contagious. And that just gives an entirely different slant. So the fear of contagion is very strong. I remember when Ebola, there was a few cases in Dallas and, some in Spain in 2014. And just the fear of Ebola sent our countries in the Caribbean into an absolute medical tailspin of what are we going to do if an Ebola case comes. So yes, COVID is thankfully not Ebola, but it's got that fear of contagion. And psychologically, it's having a very big impact. And, even persons now that the economies are reopening, for example, I was allowed back into my office since last week. And, people are hesitant. They're sort of hesitatingly stepping back into their workplace, wondering if it's safe. And so I think it's very different from Zika, where I think everyone was able to rally around the children and the mothers, the pregnant mothers, and there was really no stigmatizing, which was wonderful to see, of the children or the mothers. But the issues of stigma are real for COVID.
Yeah, do you think that the media has had a role in the sensationalization or perpetuation of the fear of these viruses?
Is
or
that
any of those diseases?
Is that a question? I think the media are, this is their bread and butter. And, this is their staple diet at the moment is COVID. And, knowingly or unknowingly, I think they are oversaturating us for what is good and healthy in terms of this virus. I think the media, generally speaking, is doing a good job, but I think they're oversaturating us. My ire would be reserved for persons and groups that are spreading misinformation and fake news. And, some of that is really quite damaging, and conspiracy theories and things like that. It's just not what we need. We have an unprecedented viral epidemic, and it's going hand in hand with basically a fake news epidemic. I mean, it's terrible.
Yeah.
I spent so much of my time as chair of this task force just dealing with, these conspiracy theories that come at me, and I take the time to answer them because it's important.
Yeah, it is important. But I guess the opposite of reporting as much as they are could also be dangerous, right? If you're not providing the right information, then people might take a more laissez-faire approach and might be out there doing all of the things that could get them infected. So there, there are two sides to it.
There has been good channels of communication. The official channels of communication from the countries to the populations, they've been very transparent. There hasn't really been any hiding of cases. I think it's been very good. And as you know, in public health, the pillar of public health is basically trust. If you have trust between the caregivers and the public health advisors and the population, your outcomes are going to be good. If there's no trust, it's hopeless.
Yeah. And what about death count, right? The way the death is reported or the counts are reported, there are, instances where a death might have been attributed to COVID-19 without any sort of conclusive proof. Is this something that is also happening in the Caribbean? How do you address all of this?
Not that I'm aware of. As I said, we've had so few, and I'm in touch with the medical chief of staff and the hospital directors, and every now and then I call them and I just want to have a reality check. I said, are our figures really right? There are so few deaths. So, what is it there right now? What's your emergency room like? And I would go to our hospital here in Bridgetown, and it's quiet. The emergency room is quiet. The intensive care unit is quiet. There's hardly anyone there. We've only got 3 people left in the quarantine center who have an active disease. So, it is genuinely quiet.
Yeah. Do you think that the geographic location of the Caribbean has a role to play in this?
I think it may. It had a temporal role. So the Caribbean was fortunate to be in the 3rd wave. So in the last wave of the disease. So as you know, Asia was the first wave, North America, Europe was the 2nd wave, then Africa, South America, and Caribbean was the 3rd wave. But, look at what's happening in South America. It's now the hotspot of the epidemic. So the Caribbean was fortunate in that it had time, but it did use that time to prepare. And I think it was well prepared when we did have our first case 99 days ago. And, almost all countries reacted straight away to have limitations of movement and border closures much quicker than the European and US countries did. So we did learn, but I think we put that time to good use. And we have published on this, comparing ourselves to countries that have had difficult outbreaks and those that have had successfully managed outbreaks. It's very clear that the Caribbean responded very quickly.
Yeah, there was some interesting news articles in the US as well on how small islands like St. Lucia was able to achieve containment relatively early, and how the US could take examples from them. So that was interesting. So we're about 5 minutes away. Are there any last words that you have for viewers, for people who may come back and
are there any questions from any persons who are online? I mean, you'd be interested to know what other people are experiencing, or if they had any questions.
And please feel free to use the Q&A function here to ask questions, if any. And then in the meantime, I guess you can, if you have any advice for what people should do in the event of an outbreak, following this one, of course. Well,
in the Caribbean, we have hotlines that every country has a hotline that you can call. And, in the initial phases of the outbreak, when we were dealing with cases, because although we've contained it now, we did have cases to begin with. And so it took us a little while to just sort of get into rhythms and routines. But right now, the routines are very well established. You've got nice segregation of parts of the hospital, which would be for persons who do not have COVID, for those who have suspected COVID. Then we have quarantine facilities where, treatment has been very good. So my advice would be, come forward if you suspect that you have the symptoms, the cough, high fever, shortness of breath, loss of sense of taste and smell. Come forward and you will be looked after well. And I would also say, if you have any other non-COVID related health issues, again, access the healthcare systems, because ultimately it's one body. It doesn't really matter if it's, let's say the hypertension that causes us morbidity, or the virus. We need to look after our health. And I think a lot of people have been putting quite important health matters on the back burner while they are concerned about the virus. And in the Caribbean, at least, I would say you really have no concern about contacting your healthcare providers to actually look after your other health matters.
Yeah, so I do have a question, which is, are there any regulatory or policy challenges that you've been coming up against, or that you think needs absolute dismantling in the Caribbean?
I can't think of any. I don't know what you're getting at, but I can't think of any.
Just asking innocent questions. We do have one question from we have a couple here. Vince is asking, are there any plans to develop a tourism app with contact tracing and safety effort of the theme? So Vince, this is...
You can answer that one.
Yeah, I absolutely can answer that one. Vince, yes, and you're in Guam, so we know that there's active engagement there as well. We do know that there is a need for a solution for tourists as they go across borders. That is important. I think the most important thing here is interoperability. A lot of countries have their own applications developed, and of course we have ours that is deployed all over the place right now. But there is the need to have them, able to communicate with each other. I don't think there is a need for a tourism-specific app. I think the functionality is the same, which is the ability to receive exposure notifications if you do come into contact with someone who subsequently tests positive for, COVID or whatever infectious disease that we're up against. The issue here is a regulatory one, which is just allowing someone who goes to a different country to have access to that country's server so that they could actually receive those notifications. And so it is an ongoing conversation, and we're actively engaged in that. And we're seeing a lot of instances where governments are saying, listen, if we want people to travel from our country to the next, we have to have those policies in place that allows them to access those servers that would give them notifications. So currently there is no specific tourism app, but we're including a number of functionalities in the app that would allow it to work for each of those concerns. I hope that answers the question. And then I see someone else says, in India also we had better COVID-19 in islands. Is it that islands are better places to be, or is it the health and systems there in the islands which can be attributed?
I'm not certain how large the islands would be in India. I would say that geographically we would have an advantage in the sense that our islands we're quite equatorial, so have quite constant, relatively high temperature. So this is a seasonal virus, although of course we're having it in all seasons now because it's the first wave and everyone is susceptible. But I think there's very good evidence that it is worse in colder climates. It likes sort of cool, humid, sort of just the right kind of humidity is what it likes.
Like the flu.
Yeah, exactly. But then I think on islands, I think you do benefit from this sense of being a small family, and it is definitely easier to contact trace. Contact tracing is critical, and you really can contact trace well in small islands, particularly very small islands.
Yeah, this is great. Thank you so much. I know you're busy. We all have a lot of things going on. We're right on time. Thank you so much for the questions and for attending. And Dr. Clive.
My pleasure, Khalil. I really enjoyed speaking with you. I'm sorry that Sienna had her internet difficulties, and I'm doubly sorry that Elizabeth Riley, who really has been a pillar of the Caribbean support, wasn't able to be on the line. She's the acting head of the Caribbean Disaster and Emergency Management Agency, and I really want to take my hat off to them. They've done a magnificent job. Yeah,
I'm sure she has a great excuse as to why she couldn't be here. All understood.
Yeah, she's probably managing some major emergency.
Exactly. But thank you so much, and I will be in touch with to get Yui and the Caribbean islands that we're not yet engaged with access to our solution. It's free and it's open source, so there's no reason why it cannot be used.
Thank you very much, Khalil, and it's been a pleasure, and thank you also to everyone who was online and who participated.
Thank you so much. Bye-bye.
Bye.